Hey guys, I hope you're well. Today we're going through some Gphc exam questions. So these are the official Gphc exam questions they release every year, and these are the old ones. I can't remember which year these were. So let's start with how I would approach these questions, assuming I was in the exam. So in the exam, I would approach it like reading the question. So in the exam, you're going to be nervous, you're going to be anxious, you're going to feel every type of emotion. You've been preparing for these exams for a long time. You've been 4 years at AMCOM, so you're going to be stressed out. Now, let's read the question. Which of the following is the most suitable drug treatment for his acute attack of gout? So in the exam, you can hear that stuff. Let's look. 68 year old man. His gender won't be relevant to this question. If it was relevant, maybe to the blood score or something like that, then maybe or even an acute attack of gout. Now, before we look, which drug do you give for acute attack of gout? You give focusing, not allopurinol, right? He had a STEMI, so ST elevation, right blood infarction, 3 years ago, and has mild osteoarthritis, but is otherwise well. He's taken the following medication, aspirin 75 milligrams once daily, with probably a secondary prevention of cardiovascular risk reduction, atorvastatin 40 milligrams once daily, high intensity statins, some painkillers, and some ACE inhibitors, which can potentially cause hyperkalemia. And he has no known drug allergies. What is following is the most suitable drug for his acute attack of gout. Let's eliminate which things you won't give. You don't give allopurinol, so that's an X. Diclofenac is an acid, and you don't give that for acute attack of gout. Preventive is a selective so for the you wouldn't give either. So the answer will be Fortune for acute attack of gout. So let's quickly um, go to sort of um, the BNF and check what they say. So protein is used for acute gout and it's given 500 micrograms 2 to 4 times a day until symptoms are relieved. Total dose per course did not exceed 6 milligrams. Do not repeat course within 3 days. So this is the indication for protein for acute gout, and that's very important quickly and months. So let's go to question two. So 54-year-old woman started to take glyglitsone. Glyglitsone is an anti-diabetic drug, and it's indicated of failure, and there's a lot of reasons why. Once daily prescribed by the GP 1 month ago, alongside metformin, etc. When collecting to repeat prescription contains having dark urine, right? This could be a sign of hepatotoxicity when you have dark urine, nausea, and fatigue for the last 2 weeks. You want this if a new tablet is taken. So what is the issue here? It's taken it alongside metformin, which is used for type 2 diabetes, and she's complaining of some sort of hepatotoxicity signs, some nausea, some fatigue, and the symptoms described were not known to be caused by diabetes. I think that's wrong. I do believe she may be experiencing a side effect of Parkinson, but I could be wrong. I do believe that this could be some sort of red flag. So I think it's going to be D for this one. Thanks so much.